Hello everyone, happy morning, a very good morning. I hope and I believe all of you are doing well. A quick note whether the audio visual is all good. All right. So, welcome everyone to the YouTube live session today where we are going to simplify the topic of contrast media, particularly the iodinated contrast media, right? And many of us find this topic difficult, particularly the chemistry part of it, ionic monomer, non-ionic monomer, what is the iodine particle ratio and all of that. So we are going to simplify that topic for today. And why there was no pre-test? Because it was radiology today and we are discussing radiology here. Yeah, but actually forgot to put the pre-test. We will have the post-test at 10 p.m. Okay, we'll have the post-test of radiology at 10 p.m. on our Telegram group. All right. So we are going to talk about the chemistry part of it. This might not even look like, something related to the medicine part. But yes, this is something which is important and we'll try and simplify it with the easy tricks. Now, all the students here, let me tell you about the new batches that we have started recently. We have started with INICT 2 months batch. We have also started with MCQ Marathon, where we are only going to discuss the MCQs. That has also started yesterday. And even for FMG students, the new batch, the 2 months course, has started yesterday. The next plus course with me for radiology will be tomorrow and day after, that is 11th and 12th March, where we are going to discuss the PYQs in radiology from all the exams, FMGE, NEET PG, INICT, all the PYQs to give you an idea on what kind of questions are being asked. So 11th and 12th, 8 to 10 p.m., this is when we have the next plus class, right? And in the all educator revision batch, we have like 40 plus educators who are going to be there in the batch. And we have radiology on 26th and 27th of March, 9 to 11 p.m. Right, 2 days again for radiology. Happy morning, everyone. So after this session, let me tell you what's the plan for today. All right, what is the plan for today? After this session, the YouTube session, we are going to have, give me a minute, right? So we have the open house session. As soon as we finish this, we will have the open house session on the app. What is open house? Basically, it's a podcast sort of thing, an audio call over which we connect. So it is at 10:15 a.m., right? And then at 5 p.m., like every day, we have the free special class on the app. We have KBMD. Yesterday, we had top 10 mnemonics. Today, we will have Fast 5 KBMD. Okay, the Fast 5 clinical questions KBMD, where we discuss concepts and the important topics to the KBMD. Okay. So, is it good to join the revision batch now? You still have 2 months, right? So you can definitely join that batch, especially if you have not completed doing one reading, you just want some high yield stuff for the exam, then I would recommend joining that batch. All right. And these are the subscriptions that we have for the plus. We have the option of 3 months also available. Iconic, that is with Prep Ladder, minimum is 6 months. And whenever you are subscribing, you can use my code Dr Nikita Live, and that will give you additional 10% off while you are subscribing. All right. Now talking about the iodinated contrast media. Okay, first of all, tell me, where do we use these iodinated contrast media? First, let us understand the concept. Where are iodinated contrast media used? In any modality which is X-ray based, wherever you are using X-rays, we will need iodinated contrast medium because iodine is radio opaque. So it could be contrast enhanced CT. CT is nothing but three-dimensional X-ray. It could be your contrast X-rays, like HSG is a contrast X-ray. IVP, intravenous pyelogram, hysterosalpingogram, even ERCP, where we under fluoroscopy we do the procedure for the biliary tract and the pancreatic duct. There also we use iodinated contrast. So wherever there is X-rays, iodinated contrast is used. These are water soluble contrast media, so they can be given IV as well, right? They are given IV. During CT abdomen, they are given orally as well, okay? To distend the bowel with the white contrast, we give the oral iodinated contrast. Is there any separate batch for only PYQs? Yes, Lakshmi. So that's what I said. 11th and 12th, like we have radiology, there's an entire schedule for the PYQs which is there. Right, where we just would be discussing the previous year questions. Okay, so in iodinated contrast media, talking about the chemistry part of it, the iodinated contrast media, it could be ionic, right? It could be ionic or it could be non-ionic. Okay, it is ionic or it is non-ionic. An easy way to remember is the contrast media whose spelling ends in ATE, they are ionic. The contrast media whose spelling ends in OL, they are non-ionic. So like when I say iohexol, OL, it is non-ionic. When we say ioxaglate, okay, ioxaglate, ATE, that is ionic. So basically remember OL, that is your alcohol jaise, that is non-ionic. Carboxylate jaise, that is ionic. So iopamidol, ioversol, all of these will be non-ionic. Ioxaglate, ditrizoate, iothalamate ending in ATE, they would be ionic. Okay, they would be ionic. So that is the first trick that you should remember, OL versus ATE. Yes, Megha, only the plus subscribers can join the PYQ batch. Okay, it's a plus subscribers exclusive batch. All right, so let's have a look at this classification here. Look at the ionicity. Ionic, ionic, non-ionic, non-ionic. Look at the examples of the ionic. Okay, look at the examples of the ionic that we have here. What are the examples? Ionic ditrizoate, iothalamate, ioxaglate. Look at the non-ionic ones. Iohexol, iopamidol, ioversol, iodixanol. Okay, so that is the first thing to remember for understanding ionic versus non-ionic. Now, the next thing is which is ionic monomer and which is dimer, right? So these contrast media, they could be monomer or they could be dimer. Monomer means there is one benzene ring to which 3 iodine are attached. Okay, every ring has 3 iodine. Dimer means the double. There are going to be 2 rings with 6 iodine, right? So monomer basically means one ring with 3 iodine attached to it. Dimer will have 2 rings with 6 iodine attached to it. Okay, so that is the other concept that we need to know. Now, remembering the examples of these contrast media, like what are the examples of ionic monomer? What is the example of ionic dimer, non-ionic monomer, and non-ionic dimer? Basically, this is what we need to remember as well. So here, let me show you this. So the easiest of this to remember is, non-ionic dimer. This is the one which is asked very frequently also is iodixanol. So how do we remember iodixanol? It is OL. OL means it is non-ionic. It has Di in its spelling. Di means it's a dimer. So basically, it's a non-ionic dimer. The example is one only, that is iodixanol. Rest all of your OL would be your non-ionic monomer. Iohexol, iopamidol, ioversol, iomeprol, iobutridol, whatever. Iodixanol is the only one which is the dimer. Rest of them are your monomers. Even your iopromide, ioxylan, not ending in ATE, those are your non-ionic. For the ionic contrast, the examples for the ionic contrast, all of them you can see iothalamate, ditrizoate, metrizoate, ioxaglate, and it is acid. Okay, right? Acid is basically your carboxylate, right? Carboxyl group, carboxylate. So it could be acid or it could be ATE. Those are your ionic example. Similarly, in ionic dimer, we have one example, that is ioxaglate. Rest all of them are ionic monomer. So remember, it is glate, which is basically your ionic dimer. So how do we remember this is? So we have four groups of contrast media: ionic monomer, ionic dimer, non-ionic monomer, non-ionic dimer. Right? We have the four groups. In dimer group, you have only one example. Okay. So in dimers, we have only one example. So non-ionic dimer, what is the example we saw? It is Iodixanol, right? It is non-ionic and it is a dimer. What is the example of ionic dimer? There's only one example, that is ioxaglate. Okay, that is ioxaglate. Rest all of them ending in ATE or acid would be ionic monomers. Rest all of them OL or the non-ATE would be the non-ionic monomer. So if you remember this much, it's easy to remember the example. Okay. So remember that dimer has only one. Dimer has only one example, be it ionic or be it non-ionic. Okay. Again, ionic dimer, non-ionic dimer. What is the example of ionic dimer? What did we see? What is the example of ionic dimer? Only one example. What is the example of ionic dimer? Ionic is ioxaglate, right? It is ioxaglate. Non-ionic dimer is iodixanol. Okay, it is iodixanol. Yes, Dhaval, we were talking about ionic. Non-ionic is iodixanol. All right. So a quick thumbs up if everyone is clear till here at least. What is ionic? What is monomer? How do we remember the examples? We are halfway through the contrast media, right? Understanding the groups and the examples. Okay, understanding the groups and the examples. Now coming to the next part, that is understanding the iodine particle ratio. Okay, this is again important. Understanding the iodine particle ratio. Now the number of iodine is decided, like any contrast medium, when we give the contrast media, how much iodine it is giving, that is decided by whether it is monomer or it is a dimer contrast. Okay, whether it's a monomer or it's a dimer contrast. All right. If it is a monomer, tell me how many iodine will it give? If it's a monomer, how many iodine will it give? Monomer will give how many iodine? Absolutely right, Nuzat, because we said that monomer has 3 iodine. Dimer will give how many iodine? Dimer will give 6 iodine. Okay, dimer will give 6 iodine. The number of particles that will be given is decided by whether the contrast is non-ionic or the contrast is ionic, right? Ionic contrast means that it is ionizing. It forms a cation and an anion, a positive and a negative. That means it is giving 2 particles. It is ionizing and it is giving 2 particles. Non-ionic means it does not ionize. It remains as one complete particle. Okay. So non-ionic will give 1 particle. If you understand this concept, it will be very easy to understand your iodine particle ratio. All right. So basically iodine is decided by monomer or dimer, 3 iodine, 6 iodine. Particle is decided by whether it is non-ionic or it is ionic. Ionic ionizes 2 particles, non-ionic 1 particle. So suppose if I ask you what will be the iodine particle ratio of non-ionic monomer, what do you think would be the answer? What would be the iodine particle ratio of non-ionic monomer? Is it going to be 3:2, 3:1, 6:1? What will be the iodine particle ratio of non-ionic monomer? Very good. So first look at, we are talking about iodine is to particle ratio, not particle is to iodine. So for deciding the iodine, it is monomer, that is 3 iodine. It is non-ionic, that is 1 particle, right? So 3:1 will be the ratio, right? 3:1 will be the ratio. Clear with everyone? So we have ionic monomer, ionic dimer, non-ionic monomer, non-ionic dimer. What will be the iodine particle ratio of each of them? Ionic monomer. Monomer, 3 iodine. Ionic ionizes 2 particles, 3:2. Right? It will be 3:2. Ionic dimer. Dimer will give 6 iodine. Ionic will give 2 particles. It is 6:2. That is basically 3:1. Non-ionic monomer. Monomer, 3 iodine. Non-ionic 1 particle. It will be 3:1. Right? It will be 3:1. Non-ionic dimer. Dimer will give 6 iodine. Non-ionic does not ionize. It will give 1 particle. Right? So this is going to be the iodine particle ratio. Look at whether it's monomer or dimer, whether it is ionic or non-ionic. So now if I ask you, how much is going to be the iodine particle ratio of iodixanol? What do you think would be the answer? What will be the iodine particle ratio of iodixanol? Very correct. Iodixanol is OL. It is non-ionic dimer. Dimer is 6 iodine. Non-ionic is 1 particle. So it is going to be 6:1. What will be the iodine particle ratio of dicreozoate? Remember the brand name of dicreozoate. You have your gastrographin, urographin. The options given in the exam. Gastrographin, urographin are nothing but your ionic contrast media, iodinated. Dicreozoate, how much will be the iodine particle ratio? Very good. So dicreozoate is ATE is ionic. It is not your ionic dimer. Ionic dimer is only ioxaglate. It is ionic monomer, right? So basically it is ionic monomer. Monomer, 3 iodine, ionic 2 particles. So 3:2, right? It is going to be 3:2 because it is ionic monomer, right? It is ionic monomer. So that's going to be 3:2. Okay, is that clear with everyone? It's going to be 3:2. It is an ionic monomer, dicreozoate. Ioxaglate is the one which is ionic dimer. So it will give 6:2. That is 3:1. Okay. So let's have a look at the table here. The iodine particle ratio, is it mentioned? Right, this is what it is. So ionic monomer, 3 and 2. Ionic dimer, dimer is 6 iodine, 2 particles, 6:2, that is 3:1. Non-ionic monomer, 3 iodine, 1 particle, dimer is 6 iodine, non-ionic 1 particle. Everybody is clear with this classification here? So let us write it down here in our table. What is the iodine particle ratio? Okay, what is the iodine particle ratio? Ionic monomer, 3:2. Ionic dimer, 6:2, that is 3:1. Non-ionic monomer, monomer 3 iodine, non-ionic 1 particle. Non-ionic dimer, 6 iodine, 1 particle, that is 6:1. So if you look at these contrast media, which is the one which is giving the maximum particles, the ratio 3:2, 3:1, 3:1 and 6:1. Which is the one which is giving the maximum particles? All these are effectively 1:1. This is the one which is giving 2 particles, right? Effectively, this is the one which is giving 2 particles. So remember, that is the one which is high osmolar contrast medium. Osmolality is high. It is high osmolar contrast medium. Okay. You can also remember it as I am high. I am in a high state. I am is ionic monomer, is high osmolar. Okay, it is high osmolar. The other one 3:1, 3:1 जिसका है, both of these are low osmolar. But remember that low osmolar does not mean that the osmolality is less than plasma. It just means that as compared to high osmolar, the osmolality is less. High ka osmolality is 2100. These are 600 to 900, okay, which is more than plasma. And the one which is iso-osmolar, this is a frequently asked question. 290 approximately like plasma, iso-osmolar. That is your last one, non-ionic dimer, Iodixanol. You can remember it as iso is non-ionic dimer. That is basically I saw, Nodi, that is Modi. Imagine you, just getting a site, getting to see PM Modi. So that is I saw Nodi, that is actually M, that is Modi. Iso-osmolar is non-ionic dimer. Okay, it is non-ionic dimer, which is your iso-osmolar. Okay. So if you remember the 2 examples, okay, if you remember the 2 tricks, one is I am high and the second one is I saw no D. That is I am high is ionic monomers are high osmolar contrast media. I saw, that is your iso-osmolar, is non-ionic dimer. Okay, iso-osmolar is non-ionic dimer. So the rest of the 2 groups, ionic monomer yahan chale gaya, so ionic dimer, non-ionic dimer is here, so non-ionic monomer. These are going to be low osmolar contrast media. Okay, those are going to be low osmolar contrast media. So remember, I am high and I saw Nodi. Okay, that is non-ionic dimer is iso-osmolar. Okay, that is iso-osmolar. So thinking logically, which will be the best contrast to use? Iso-osmolar, low osmolar or high osmolar? So which one will be your best contrast to be used? Iso-osmolar ideally should be the best because its osmolality is same like plasma. But the disadvantage with this is very, very viscous. The viscosity is very high. So it does not flow easily through the IV cannula and even in the blood. And that is why this is not used very frequently. The one after that, the best or the safest is low osmolar contrast medium. Even in the low osmolar, is it ionic or non-ionic? It is non-ionic, which is better, right? It is more safer. So the one which is used very commonly, the contrast medium which is used commonly in our daily practice is basically your non-ionic monomer. That is iohexol is very commonly used because it is safe, it is low osmolar, it is non-ionic. Why do we prefer non-ionic? Because the osmolality is also less here and it does not lead, even if it goes out, it does not lead to edema vagera. Okay, so we prefer using iohexol, which is non-ionic monomer, which is low osmolar contrast medium. So suppose if you get a question that there's a patient whose DFR is low on the lower normal side, which group of contrast will you prefer? Non-ionic monomer, iohexol. Okay, that is the safest to be used. Low osmolar non-ionic monomer is what we would be using in those patients as well. All right. So looking at the classification now, I think these tables would be now decoded. So basically we have ionic monomer, ionic dimer, non-ionic monomer, non-ionic dimer, right? These are the 4 groups. Ionic will be ATE. In dimers, we have only one example. That is ioxaglate is ionic dimer. Iodixanol is non-ionic dimer. The rest you will fit into the rest of the tables, right? Now, I am high, that is ionic monomer is high osmolar. Isonodi, that is isoosmolar is non-ionic dimer, right? The rest of the two groups are low osmolar, but higher than the plasma. Iodine particle ratio, ionic monomer, monomer 3, ionic 2. Ionic dimer, dimer 6, ionic 2, 6 is to 2, 3 is to 1. Non-ionic monomer, 3 iodine, 1 particle. Non-ionic dimer, 6 iodine, 1 particle, right? That is the iodine particle ratio. This is what we need to know here in this table. I think this is now decoded. Look at this one. This is a monomer having 3 iodine. Carboxylate, it is your ionic monomer. Okay. This is a dimer which you have dimer with carboxyl group. That is ionic dimer. This is the one without carboxyl group, non-ionic monomer. This is a dimer without carboxyl group. This is non-ionic dimer, right? This is again the same thing, classification, ionic, non-ionic, monomer, dimer. In dimer, you have only one example. Remember that. The rest of it would be easy. Okay, the rest of it would be easy. So to summarize here, iodinated contrast media, which are high osmolar, I am high, right? Ionic monomer is high. Tell me the example of ionic monomers. Tell me the example of ionic monomers. Ionic monomers, ditrizoate, right? You have iothalamate. These are the examples. I saw no D. What is the example of non-ionic dimer? What is the example of non-ionic dimer? It is iodixanol, right? Dimer and non-ionic, iodixanol. The rest of the two are your low osmolar contrast media. They have the iodine particle ratio of 3 is to 1. Okay, they have the iodine particle ratio of 3 is to 1. All right. So suppose if I ask you the question now. Right. So the question is, all of the following are true about iohexol except which of the following? Okay, all of the following are true except which of the following? So tell me whether it is true or false. Iohexol is a non-ionic iodinated contrast. Is it true or is it false? It's a non-ionic iodinated contrast. Is this true or false? Yes, it is iohexol. It is OL. So this is a true statement. Next one, it is a high osmolar contrast medium. Is it true or is it false? It's a high osmolar contrast medium. True or false? This is a false statement. High osmolar is I am high. It is ionic monomer which is high osmolar contrast, right? This is non-ionic. So this is false. It's a low osmolar contrast medium, right, Neerja? Isoosmolar is your iodixanol. Here we are talking about iohexol, okay? Iodine particle ratio. Iodine particle ratio is 6 is to 1. Is this true or is this false? Iodine particle ratio is 6 is to 1. True or false? Yes, it's a false statement because iohexol is a non-ionic monomer. Monomer will give 3 iodine, non-ionic will give 1 particle. So it is 3 is to 1. It is not 6 is to 1. Okay, it is 3 is to 1. It is not 6 is to 1. Absolutely right, Dr. Nisha. So I hope this chemistry part of the iodinated contrast media is clear. Right? What are the side effects that we see with this iodinated contrast media? The most common side effect is anaphylactoid reactions. Remember, it is anaphylactoid, not anaphylaxis. That means it is non-IgE mediated, right? Sometimes it could be so severe that a patient might lose life as well. So very, very important to be cautious about that. Patients who already have allergic history, asthma, atopic dermatitis, they are at increased risk. So that is why we need to ask this history in such patients. Second, very important, it can cause contrast-induced nephropathy. Contrast-induced nephropathy. So we should always check serum creatinine. This is the question asked. Serum creatinine, that is basically your RFT or KFT, should be tested before giving contrast. We should check that it is normal. From creatinine, we calculate the GFR. 50 is what is normal, 50 ml per minute. So we need to check serum creatinine before giving IV contrast. Without checking that, we do not do the contrast scan. Okay, we do not do the contrast scan. That is very, very important to remember. So we need to check the serum creatinine. Right? How can we prevent this contrast-induced nephropathy? What is the most effective measure to prevent this contrast-induced nephropathy? Most important is hydration. Okay, most important is hydration. Hydration, not orally, but by giving IV normal saline. Okay, hydration is the most important, most effective measure to prevent contrast-induced nephropathy. That is hydration. Use your low osmolar contrast medium. That is your non-ionic monomer. Prefer using that. So iohexol is generally preferred. Okay, that is generally safer. All right. So yes, that was about the iodinated contrast media. I hope it's now easy to remember what is ionic, what is non-ionic, what is the iodine particle ratio, what is the osmolality, and which contrast do we prefer, right? So now immediately after this, we start with the open house session on the Unacademy app. I believe you might have the link here. Right, you have the link in the description of this video as well. I have shared on the Telegram group also. So any queries you have, please feel free to ask in the open house session. And yes, if time permits, there would also be a dose of motivation coming your way. So that was for this session. And the next plan, as I mentioned for today, open house, and then 5 p.m. we have Kaun Banega MD, the live quiz, fast 5 clinical MCQs. All right. Thank you so much, everyone, for joining in. And goodbye. Take care. Keep studying, keep revising, and keep winning. Thank you.